Hi, this is Dr. Lim with the Institute of Dermatology and Oculoplastic Surgery, board certified Mohs surgeon, board certified dermatologist. Today, I would like us to talk about a condition called melasma or mask of pregnancy. This is a condition that presents as hyperpigmentation or excessive pigmentation of the skin of the face. While anyone can be affected, it happens much more commonly in women as compared to men, especially women of childbearing age. And in terms of ethnic predisposition, it tends to happen more in people with darker skin types, African Americans, Hispanics, East Asians, South Asians, and people with origin in the Middle East. It is more prevalent in areas of the world with higher sun, with more ultraviolet light index. When we talk about the pathophysiology of melasma, essentially, it is a condition of overactivity or excessive activity of the pigment producing cells called melanocytes. And the reason why it often happens in pregnancy or in some people can happen with oral contraceptive pills or birth control pills is that the hormones, estrogen, progesterone, can trigger the melanocytes to produce more pigment. When we talk about treating melasma, the foundational concept, the most important concept is sun protection. It is very important to protect against the sun in patients with melasma. And in patients with melasma, not only is the ultraviolet light a possible trigger or a likely trigger, but also even visible light can be a trigger. And this is the reason why in melasma patients, we recommend tinted sunscreens containing iron oxide, because those particular tinted sunscreens will help to block out the visible light component. So to summarize again, in melasma patients, you must protect against both ultraviolet light, UVA, UVB, but also against visible light, which can be a trigger in patients with melasma. Once you have the sun protection squared away, the mainstay of treatment is lightening agents, hydroquinone containing products. The most commonly used commercial available product is a combination called Triluma, which contains hydroquinone, the lightening agent, a retinoid called tretinoin, which is a vitamin A derivative, and a steroid called fluocinolone. Um, Also, hydroquinone can be compounded in compounding pharmacies at even higher concentrations in combinations with other types of retinoids or other molecules. Non-hydroquinone containing prescriptions can include retinoids by themselves or azelaic acid. When we talk about hydroquinone, although it's a very good molecule and has been used to treat melasma for many, many years and decades, it does come with certain risks. For example, in patients who use it for a very long time without giving the skin breaks from the hydroquinone, there's a chance of an adverse effect called paradoxical hyperpigmentation, where hydroquinone, instead of lightening the skin, will switch its effect and will darken the skin. This is not common, this is rare, but this can be minimized. The risk of this can be diminished if hydroquinone is used with breaks, with giving the skin holidays from the hydroquinone. Also, in some people, hydroquinone can be irritating to the skin. Non-prescription medications or cosmeceuticals that can be utilized for melasma include cysteamine, thiamidol, licorice extract, or arbutin. Those do have evidence for helping to treat a melasma. So generally, what dermatologists will do is that we'll cycle a hydroquinone-containing topical for a certain amount of time, anywhere from 2 to 6 months, and then a non-hydroquinone-containing topical, again, to give the skin a break from that hydroquinone. In addition to topicals, there's now evidence that off-label use of tranexamic acid can be helpful in select individuals. This must be used very judiciously and carefully because it does increase the coagulability of the blood. So patients who are smokers, patients who've had deep venous thrombosis, or patients with factor V Leiden mutations, which causes them to be hypercoagulable, should not be put on tranexamic acid. So it must be used very judiciously. Additionally, certain procedures can be beneficial for select patients with melasma. These include microneedling, particular chemical peels, or light energy devices, lasers. But again, you have to make sure that these are used very carefully, very judiciously, and at the correct settings, because if used improperly, they can actually trigger or exacerbate the melasma. Melasma is a chronic condition, but it can be treated with both pharmacologic, non-pharmacologic, and procedural modalities and approaches. If you think you have melasma, don't hesitate, pick up the phone and call and schedule a visit with a board-certified dermatologist. We're very happy to see you at the Institute of Dermatology and Oculoplastic Surgery. This has been Dr. Lin, signing out.